Hello, my name is Dr. Jana. I'm very pleased as always to join Doral Juvenile Group and the Safety First brand in getting to talk to you today about practical parenting, health and safety tips as they relate to cold and flu season. For just about all parents I know, there's a lot of questions that come up when you're faced with your first cold and flu season as a parent. Wondering about things like what to do when your baby has a fever. What can you do to prevent your baby from getting sick in the first place? How to give them medicine when they need it? Which medicines are okay to use and how do you do it? And as always, the ever important question of when should you see your doctor about concerning symptoms? Now let's first start with things that you can do to prevent your baby from getting the flu. It's really important to keep current on flu vaccine recommendations, but do know that current recommendations for the 2011-2012 year suggest that all children and adults 6 months of age and above should be vaccinated against the flu. So if you haven't already, check with your child's healthcare provider, make sure you've got in place a plan to get your child vaccinated and get yourself vaccinated as well. Now, not all colds are the true influenza virus, and not all colds are preventable. So then the next question is, what do you do when your baby gets sick? You want to know, first of all, how to take an accurate temperature. And in past discussions, we've talked about stocking the medicine cabinet, making sure you have on hand those tools that you need to take a temperature. Under the age of 1, rectal thermometers are considered the gold standard for taking temperatures, but you've got lots of options available to you. A set of different safety first thermometers here, including an easy read rectal thermometer, give you an example of the range of products that you can use. But even for older children, it's useful to get an accurate temperature using a thermometer, and that way, if and when you need to call your doctor to report a temperature, you've got a number to give them. In terms of giving medication, there's been a lot of discussion about cough and cold medication lately, and the fact of the matter is that evidence does not support, in many instances, giving cough and cold medications to young children. So before you use any, be sure to discuss them and their safety, risks, and concerns with your child's healthcare provider. Absolutely be familiar with the fever-reducing medications, the acetaminophen and ibuprofen products like Tylenol and Motrin, and make sure that you always know the accurate dose to give your child because that is based on weight for infants and young children. Check with your doctor each time you go in for a well visit what the dose would be should you need to use those medications, and make sure that you use the proper measuring devices, whether that is a baby infant syringe or a measuring cup for an older child, so that you get an accurate measurement. A teaspoon from your kitchen drawer is not considered an accurate way to measure medications. And finally, the ever-present question of when to actually take your child to see the doctor. The bottom line is, anytime that you are concerned that something's not right or that you need a doctor's opinion to help you figure out whether your child's seriously ill or not, feel free to call your child's healthcare provider or take your child immediately in for medical attention. Things that should be considered concerning signs or something to discuss with your doctor include vomiting that won't stop, signs of diarrhea that won't stop, or signs of dehydration. Now understand that dehydration can be caused by fever. High fevers make a child dehydrated, vomiting, and or diarrhea. And especially in instances when all three of those things are present, make sure that you're working to get your child enough fluids, but if they're not, or if you have concerns, take your child in. High fevers are worth discussing with your doctor, but don't always imply a more serious infection. Fevers that don't go away, or any time that your child's acting sicker or less responsive or more lethargic than usual, it's good to check in and get some doctor's advice. Again, my name is Dr. Jana. It's a pleasure to share these and other health and safety and parenting related tips with you, more of which are available on the Safety First website and also through the Safety First newsletter. Thanks for joining me, and I hope you have a healthy cold and flu season.